Hello everybody. Today's video is about RSV bronchiolitis and why it can be so scary. First of all, the definition is respiratory syncytial virus. That means that this virus particularly attacks the tissue in the lungs and can lead to respiratory distress. Bronchiolitis just means inflammation of the very tiny, small airways. Now, most of the time, RSV is just a common cold. It's one of the more common causes of the common cold. So why is everybody so scared of it? Because in certain populations, particularly premature infants, even if they're just slightly premature, born before 37 weeks of gestation, and in babies with congenital heart disease, they can be particularly affected and it can be very, very serious. So let's talk about what makes RSV so special. For one thing, the mucus. When babies have an infection with RSV, the mucus they make, like with the regular cold, is even more viscous. It's thicker and it's harder to get rid of. So a lot of the things that you would do for a normal cold, you still do for RSV. You just have to do them even more. Run the humidifier on full blast, push fluids, and they may not be able to feed very well, so you may have to use the saline drops and the bulb suction syringe or the nose Frida before attempts at feeding by mouth. You may have to give small amounts very frequently. It's very important to keep track of their urine output. But what really makes RSV special is that it can lead to full-blown respiratory distress. Now, when you're at home, the signs of that can be nasal flaring. I can demonstrate this. Looks like a rabbit, sort of, just those nostrils going up and down, and it means that they have a low oxygen level. Also grunting, which is an end expiratory noise, as if they're pushing to expand their lower airways, and that's exactly what they're doing. They're pushing against their glottis to try to get their lower airways to open up more. Another sign can be very rapid breathing. We call tachypnea. Anything over 60 breaths per minute is always abnormally elevated, and that's not a good sign. So grunting, flaring, that was the nose, and retracting. Retracting just means as they're breathing, you can see their ribs coming up and down with the skin kind of sucking in between the ribs, and that's a bad sign. If the baby is under 6 months, they may use some abdominal muscles to breathe, but if they're over 6 months, they should never have to use abdominal muscles to breathe. So if they're using abdominal muscles, just extra muscles in general, you see their head bobbing or their shoulders coming up and down. We can also see suprasternal retractions, this little spot going in and out. Grunting, flaring, retracting, or just breathing fast. So basically working hard and breathing heavy and fast are all bad signs and signs that the baby's oxygen may be low. Now remember, even if your baby gets diagnosed with RSV, that doesn't mean that they're going to have to go to the hospital. We're going to check their oxygen level and make sure that they're hydrated. You can do fever control measures at home, Tylenol if they're under 6 months, Tylenol and ibuprofen if they're over 6 months. You can push fluids and do all your supportive care that you would do for a regular cold. They're only going to need to be admitted to the hospital if they need oxygen or if they need IV fluids. Now let me update you on something too. Back when I was training over 20 years ago, we automatically treated the wheezing that can come along with RSV the same as wheezing with an older child who'd had asthma. We would try albuterol, which is a bronchodilator and a breathing treatment. We would try steroids by mouth to try to calm down inflammation. And since then, more studies have been done. And actually, when a baby's diagnosed with the rapid test, it's a rapid antigen test and it's positive for RSV, it means that we typically don't really try albuterol as much anymore because that study showed that they don't respond to it. It's a different kind of wheezing than just straightforward asthma in an older child. They just have a lot of inflammation and swelling in the lower airways. And so all those supportive measures we talked about are really all that we have to offer. But if your baby has RSV, I want you to know a little bit too about the natural history. Often, we don't see the baby until they've been sick for 2 to 3 days, and that's typically when things are starting to get worse. At the very beginning, it just looks like a regular cold. Then it sort of advances and gets worse, and usually peaks in severity by day 3 to 4, it's at its peak. Now, once you're sort of over the hump and things are getting a little bit better, their fluid intake is better, their wet diaper output is good, and their breathing's easier, you're probably through the worst of it. Except any viral infection can lead to a secondary bacterial infection. And RSV is also particularly famous for doing this, especially for causing an ear infection or otitis media in infants. Just as they're recovering from the cold part and maybe the fever has already resolved and then it spikes again later, that's a good red flag that something else is going on, like an ear infection, and we probably need to see that baby back again. So don't be surprised if we're seeing your baby and it's just day 2 of illness. We may have you follow up in a day or 2 after that so we can make sure their respiratory rate's still okay, they're not in distress, their oxygen level is still okay, and they're still hydrated and haven't had excessive weight loss. Also, of course, always remember, I'm hoping to just educate you and give you some general medical advice to get you through some rough times. None of this specifically applies to your baby, and you should always take this as a general advice and call your child's specific pediatrician to ask for more directions about your case. I think that was all the stuff I wanted to share with you. So remember, don't be overly scared if your baby's diagnosed with RSV, but be more alarmed if they were a premature infant or if they have congenital heart disease. Also remember, for those babies that are highest at risk, there is a product, it's a pooled blood product called Synagis, and you may qualify for that, so be sure to ask your pediatrician about that. Thank you so much. I hope this helps.